Dr. Adnan, that was a very nice talk, and I'm sure you have more cases to share with us in the next session. So I'm going to invite Dr. Nisar now, and he's going to show us a live in a device. I've also been on the DAWN trial data safety monitoring board, and there is a little bit of a misleading notion about DAWN and the 24 hours time window. We did, I was part of our first stroke case was in December of 2000, and I'm not saying it cannot happen, but in 18 years I've not seen a single stroke patient with a witnessed onset who was an endovascular candidate at 24 hours. Typically, they are either completed strokes or have good collaterals. So the 24-hour time window in DAWN, the bulk of the patients were those with unknown onsets or wake-up strokes. And those strokes, based on imaging, and if we could go back in time to see when they happened, probably happened just a few hours before they woke up. So just keep that in mind. With the DAWN, we now get patients with a witnessed onset 24 hours earlier, patient is transferred, but the infarct is completed. We talked about TPA. We looked at our own cost and data, and it is huge. It's the difference before and without TPA. Our costs are around $30,000 US. After it's $40,000, $9,000 TPA injection. I'm not saying that TPA is not useful. It works in about 20% of the time, but the cost that we pay is not value pricing for 2 neuro biplane suites and a third one across the hallway. So this is the patient flow from the scanner to the angiography suite, from the emergency room, which is similar to, and then ICU. And we monitor times in all these locations. We employed one of the industrial engineers, Six Sigma, who trailed us, and second guessing of what my role is or what the technologist's role is, what the nursing role is. Everyone does their own job independent of what another person may be doing. Similar algorithms exist, I'm sure.
أعوذ بالله من الشيطان الرجيم الله يبسط الرزق لمن يشاء ويقطع بالحياة الدنيا وما الحياة الدنيا في الذين كفروا لو لا أنزل عليه آية من ربه.
सुप्रीम कोर्ट चीफ जस्टिस ऑफ सुप्रीम कोर्ट पाकिस्तान जनाब जस्टिस साकिब निसार साहब को, जो आज की इस तकरीब के मेहमान खुसूसी हैं, और ख़ास तौर पर मैं हदिया तबरीक पेश करती हूँ जनरल अजहर महमूद कियानी साहब को, जिन्होंने आज हमें ये इज़्ज़त बख्शी है। और ये हमारी खुशबख्ती है कि चीफ़ जस्टिस सुप्रीम कोर्ट ऑफ पाकिस्तान आज की इस पुरवकार तकरीब में हमारे दरमियान मौजूद हैं। इनकी मौजूदगी में रावलपिंडी इंस्टीट्यूट ऑफ कार्डियोलॉजी में इस नौयत की एक मुनफरिद
Dr. Bashir Hanif, President, Pakistan Society of Interventional Cardiology, Dr. Adnan Siddiqui, Dr. Ihsan Tariq Rai, members of international faculty, distinguished guests, colleagues, ladies and gentlemen. Assalamu alaikum and good afternoon. I would like to begin by welcoming all of you to Rawalpindi Institute of Cardiology. I would like to especially express my deepest gratitude to the Honorable Chief Justice of Pakistan for taking out time from his extremely busy schedule to grace this occasion with his presence. Honorable Chief Justice, your presence here today is encouraging for us and is proof of the high priority you and the Supreme Court accord to the cardiac profession and to the provision of quality cardiovascular services to the people of Pakistan. I would also like to extend a special warm welcome to our international guests and hope you are enjoying your stay here and very comfortable. Ladies and gentlemen, before I share my thoughts on the topics today, which is a stroke intervention program, I would like to say a few words about the Rawalpindi Institute of Cardiology. As you know, the Rawalpindi Institute of Cardiology is a comparatively a very young hospital. So only, I think, when I took over, that was in September 2012, and when we got the equipment, that was the first time, I think in March, we did the first procedure, PCI, and then the first surgery in March 2013, and the first year, I was the only operator, and I had one fellow with me, and in the first year, we did 1,000 PCIs in 1 year, and then gradually increased the number, and now I think we are doing more than 4,000 PCIs per year. I must mention here that Rawalpindi Institute of Cardiology is the only public hospital which is providing 24/7 primary PCI service to the people. Other institutes, they are also doing primary PCI, but it's not 24/7, it is during the working hours. So then, after that, we added pediatric program, cardiology, and the cardiac surgery program as well. Then we started doing the peripheral interventions, and the latest addition is stroke intervention, and this is the one which started in April this year. So, coming to the topic now, as you know, the brain stroke is the second leading cause of death worldwide. There are 16 million strokes per year worldwide, and 87% of these strokes are caused by ischemia. Natural history of stroke is, if not intervened, 1/3 of these patients die, another 1/3 will have a permanent severe disability, and only 1/3 are lucky enough to fully recover or live with minor disability. Like emergency angioplasty and stent for heart attack, now the standard care for acute ischemic brain stroke is urgent endovascular stroke intervention, preferably within 6 hours of symptoms onset, in which the emergency angiography of the brain is performed and blood clots obstructing the main blood vessels are removed percutaneously and blood flow to the brain is restored. The chance of opening the blocked artery in the brain by this emergency intervention is around 80%, and almost 70% of the patients who undergo this procedure, they have minimal disability at the end of 90 days, and most of them, they recover completely. This treatment is a game changer in the management of stroke patients with the dramatic results, and patient's paralysis recovering as soon as the blood clot is removed. But this is an emergency procedure which needs to be carried out within few hours of onset of stroke symptoms and before the brain is permanently damaged. As per the calculations from the world's stroke statistics, there are 31 cases of strokes per 100,000 population, and the number of stroke patients which can benefit from this stroke intervention in Pakistan, with a population of over 200 million, is around 50,000 to 70,000 per year, and Rawalpindi, Islamabad together have a population of 5 million, which translates into a 900 to 11 strokes intervention candidates per year. But the figure may be much more than this one because we are a large, huge catchment area. It's not only this part of the Punjab, it also includes the AJK, northern areas, some part of the KPK, and sometimes we get patients from across the border from Afghanistan. This is a large population who currently are suffering from major disabilities or dying at the hands of stroke, which is very unfortunate, as now the treatment exists to save them from this suffering. Management of their disability also puts a huge burden not only on the national exchequer but also on the families, because as you all know, the 2/3 of our patients, they pay from their own pocket. Since 2014, when this technology became available in Pakistan, Lahore is the only city that performed a few stroke interventions, and now Rawalpindi, Islamabad have joined in. With the lack of human resource and the required infrastructure, intervention neurology, radiology alone will not be able to carry out this service on their own. Pakistan stands no chance of starting acute stroke intervention in the near future unless well-developed specialties like interventional cardiology join this program. And interventional cardiology has the existing infrastructure all over Pakistan with skilled manpower, functional cath labs, CT scans, and etc. And they need to play an active role by training and then performing stroke interventions. Interventional cardiology in many other countries of the world, including USA, Germany, Portugal, Turkey, Czech Republic, South Africa, Slovakia, and Netherlands is already providing this service. Rawalpindi Institute of Cardiology has taken the initiative to start acute stroke intervention service through a systematic training approach, starting with a short training in USA. I'm very pleased to announce that Dr. Ansar Tadakrai and Dr. Adnan Siddiqui, who are world-renowned neurointerventionists working in USA, agreed to support our initiative by providing training to our doctors, and both are with us today, sitting on the dais today to grace this occasion. And thank you very much for coming in. April 2018, Rawalpindi Institute of Cardiology became the first cardiac center in Pakistan to have performed emergency brain stroke intervention by removing blood clots, obstructing the brain vessels, and completely reversing the patient's paralysis. RIC has already carried out 12 stroke interventions with good procedural and clinical outcomes. RIC plans to train all interventional cardiologists and make this into an emergency 24/7 service. With government support, RIC could become a center of excellence in acute center intervention and hopes to train interventionalists from all other specialties to make this service available all over Pakistan. By taking lead, Rawalpindi Institute of Cardiology hopes to motivate other well-established cardiology setups to start this vital service, and all the specialists must join hands to reduce the morbidity and mortality of stroke, and together we save our people from the misery of lifelong disability. Government can take the lead by supporting and funding this program in Rawalpindi Institute of Cardiology and then open it for training doctors from all over the country. Another important aspect that I want to draw everyone's attention is the fact that number one killer and the crippler diseases in the world are vascular diseases, which include vascular diseases of the brain, heart, and limbs. A great concept in USA is formation of vascular institutes like Gates Vascular Institute Buffalo, where under one roof they have all the specialties and that treat vascular issues, including cardiology, vascular surgery, interventional radiology, and neurointerventionist. Currently, cardiology is the only specialty in Pakistan which has developed infrastructure with cath labs and operation theatres all over the country and is already performing limited peripheral interventions as well. Facilities to provide percutaneous endovascular treatment to other vascular issues like limb ischemia to avoid amputations, and neurological issues like ischemic strokes, brain bleeds, they are lacking. And these need to be developed on priority basis, and easiest and best way would be to follow US model and bring all vascular specialties under one roof. Please engage and employ vascular surgeons, interventional radiologists, and neurointerventionists in existing Institute of Cardiology to facilitate patients under one roof for all types of vascular diseases. A new cath lab and operation theatres can be added to the existing cardiac facilities. I therefore propose that the existing Institute of Cardiology should be renamed as Institutes of Cardiac and Vascular Diseases, and as a pilot project, name Rawalpindi Institute of Cardiology as Rawalpindi Institute of Cardiac and Vascular Diseases. I once again thank the Honorable Chief Justice for sparing his precious time and gracing this occasion with his presence, and so also all the faculty's members, both from the international and local, and all the participants for attending this course and making it a success. I wish everybody great learning for the rest of the day. With the cooperation of international faculty, I am happy to announce Pakistan Stroke and Carotid Intervention course as an annual event at Rawalpindi Institute of Cardiology, and in 2019 we would also include live interventions, inshallah. Thank you very much.
Honorable Chief Justice of Pakistan, faculty, guests. It's a great privilege to be here today to participate in this event in Rawalpindi. I'm delighted to report to you that we had a similar event in Lahore yesterday, where Ansar and I and many of the foreign faculty were doing something very similar. The fact of the matter is that acute stroke, or falij, is the most common neurologic condition known to man. And for the longest time it had nothing available. There was despondency and destruction of family and individuals caused by this disease. The treatment for this disease now, particularly the worst kinds of strokes, which is taking the clot out of the brain or mechanical thrombectomy, and in minor strokes with clot busting drugs, really revolutionizes the treatment of this disease and makes this curable. In Pakistan and many other countries with limited facilities for advanced neurointerventional procedures, such as treating strokes and brain aneurysms, the cardiologists have for many decades been performing these procedures, and they have the setup that allows rapid treatment of patients who are deserving. I think a critical part is partnership between interventionalists with neurological backgrounds, surgical backgrounds, and cardiac backgrounds to participate in what we do in Buffalo every single day at the Gates Vascular Institute. We work together to treat patients for all their emergent conditions. And I think Pakistan, with reserved resources, really needs to not reinvent the wheel, but use available resources and available manpower to get them trained right to treat this severe condition. So I really commend you, Mr. Chief Justice, to come and attend this session, because that results in a lot of cameras at the back of the room, and I think the world, the population of Pakistan needs to recognize that falij, or acute stroke, is now a treatable condition, and there are centers in Lahore, in Rawalpindi, and in Karachi that are starting to treat these patients. So thank you very much for your support.
Thank you, sir.
Dr. Nouman Adnan Siddiqui, Dr. Ansar Rai, and Dr. Asim Javed, my respected and esteemed guests from abroad, and my dear colleagues. Assalamu alaikum. It's really a great honor and privilege for me to be part of this first stroke and carotid international course being held at Rawalpindi Institute of Cardiology in collaboration with Pakistan Study of Cardiology. It's really amazing to see so much interest being shown by interventional cardiology, neurology, and radiology colleagues in stroke intervention program, as evidenced by the number of participating professionals from all over Pakistan. As has been mentioned, that stroke remains the leading cause of death and disability all across the world. And unfortunately, disability post-stroke not only adds to misery of patient, but would have a huge economic burden and impact on the patient and his family. Despite the high prevalence of stroke along with high morbidity and mortality rates, there has been limited treatment modalities offered worldwide, especially in underdeveloped countries like Pakistan. Unfortunately, at present, most hospitals in Pakistan offer conservative treatment to patients with stroke. Rawalpindi Institute of Cardiology has taken this initiative and has started this stroke intervention program, and it really is highly commendable. I feel it is high time for all the specialties, including neurology, neuroradiology, and interventional cardiology, to join hands together to fight this menace to reduce the high morbidity and mortality and disability in our stroke patients. Working in cath labs 24/7 for years and being able to treat the blocked arteries, especially in acute heart attack, interventional cardiologists may be the best, easiest, and quickest way to solve the problem and start acute stroke intervention program all across Pakistan. As it has been shown earlier, recently in Euro PCR 2018, and the chairman of ESC Council on Stroke as well as experts from US has really stressed the need and felt that probably the interventional cardiologist will be the easiest and quickest to learn these techniques and start these programs. Patient safety and better outcomes should be the only goal, without any concern for our turf war by neurologists, neuroradiologists, or interventional cardiologists. I strongly feel that close collaboration of interventional cardiologists with our dear colleagues from neurology and neuroradiology is just the right way forward for providing best treatment and better outcomes to our stroke patients in Pakistan. And as President of Pakistan Society of Interventional Cardiology, I would like to offer my full support for this cause. At the end, I would like to really congratulate and commend General Azhar Kiani, Dr. Asim Javed, and their team at Rawalpindi Institute of Cardiology for taking this initiative and holding such a successful academic meeting. Thank you very much.
थैंक यू सर। अब मेरे साकिब निसार साहब से कि आप तशरीफ़ लाएं और वर्कशॉप में बैरून ममालिक से खुसूसी तौर पर शिरकत के लिए पाकिस्तान आने वाले इन मारूफ कार्डियोलॉजिस्ट्स को जिन्होंने इस शोबे में कारहाय नुमाया सर अंजाम दिए हैं, इनकी खिदमात के एतराफ़ में इन्हें शील्ड्स पेश करें। Welcome to the distinguished foreign faculty to this impressive ceremony, and hats off to their dedicated services to the humanity. Dr. Ansar Tariq from USA. Dr. Adnan Siddiqui from USA. Dr. Usama Yassin from Egypt. Dr. Ahmad Sobri from Malaysia.
Bismillahirrahmanirrahim. Major General Retired Azhar Mahmood Kiani Sahab, the Executive Director, Rawalpindi Institute of Cardiology, organizers, experts, foreign guests, participants of this course in the workshop, ladies and gentlemen, thank you for inviting me to the Pakistan Stroke and Cardiac Intervention course. It is an honor to be here. Before I commence with my written discourse, let me share with you why this little passion, small contribution, some effort for the purposes of lending my shoulder, giving my support to the healthcare system in Pakistan. I never thought that I'll share this with you while here, but Umair's presence, Dr. Umair's presence has in fact prompted me. My mother has been very ill throughout of her life. When I grew up, I always saw that she had been a victim of one ailment or the other. I've been taking her to the hospital. I've been taking her to the different doctors, almost all the experts of the city, including Lahore, Dr. Akhtar, Dr. Sadiq Khaja, Dr. Mahmood Ali Malik, maybe many others, Dr. Walayat Ali Khan. And everywhere I found that the healthcare system in Pakistan is only available to a person who can afford it, who has some privilege. In the hospitals, the things which were or should have been up to the mark, up to the standards, they were not available. I also recall of that day when in Dr. Chaudhry Rashid's clinic, my mother collapsed and she was revived by Chaudhry Sahib. I was present there. I was asked to leave that small operating unit of where that procedure was being conducted. That always has been at the back of my mind. Whenever I would get a chance, the first thing I would attempt to do would be to improve the healthcare system in our country. I got the chance. I have endeavored and made the best effort that I should contribute as far as the legal part of the system is concerned. And while doing so, my brothers and sisters, the doctors, the experts, the eminent physicians and the surgeons, let me tell you that this has been a pathetic experience of my life. I have almost visited each and every hospital, the tertiary hospitals, almost all over the country. And I am making a very responsible and a candid declaration that a poor and a person who doesn't have any connections, except now that things have improved, in the past has not been able to get a good health care, which is his fundamental right. Right to life is the most primordial right. This is in the course of my written discourse also. That why is this earth unique? Why? It's only unique because there is life on it. Otherwise it would have been just like a barren rock, just like any other planet in the universe, where there is no life and there is no significance. And when we talk about life, the first thing which comes to our mind is the quality of life. Miserable life is no life. The life with pain, the life with curse is no life. And Allah Almighty, in fact, has bestowed all of you, sir, sitting here, with an extraordinary ability, a capability, a faculty, a gift, that you serve the ailing section of the society, the miserable, the pain in the society, for which I believe honestly that it is the government of the day which has to contribute both in terms of improving the public health system and also to look after you people. When I went and saw some of the hospitals, tertiary hospitals, let us take an example of the Services Hospital Lahore. Do you believe that there were no foundational, fundamental equipments for the purposes of treating or looking after the patients who come into the emergency? I know it as a fact that in the same hospital, few of the ventilators were out of order and which were in their working condition when somebody with a safarish, somebody who's, mashallah, wealthy person would come, the person already put on ventilator, his ventilator would be removed and given to the gentleman who had the resources or who had safarish. Is this not an apathy? This is what has been happening. Do you know that the Supreme Court of Pakistan judges have been contributing to some of the units in the service hospital because there were no essential medicines available in that unit? And the doctors, the nurses, the bearers of the unit, they in fact were fatigued to contribute in order to save the lives of the poor people who could not afford the medicines or other treatment in that unit. The Supreme Court judges, I collected that money and we helped out for having the equipment being put to order, and till day I think some contribution is regularly going to that unit for the purposes of providing the medicines. When I started on with this campaign, it's a very little effort, gentlemen. I had only attempted to bring awareness, to make people conscious. But it was an effort when I started with this. I came across certain units pertaining to our psyche department. I was visiting KPK. There were about 200 patients, and the condition I could only describe in the words of the Chief Secretary who was accompanying me. I asked him, what is this? 3 people lying on one mattress, and I believe that mattress was not good enough to lie on. And I said, what is the condition? He said, sir, horrible and miserable. This is a failure of the state. It's not our failure, sir. I went and saw the unit about 3 weeks ago, Punjab Institute of Cardiology. And I would be failing again in my duty if I do not compliment Dr. Nazeem Hayat, because I have been a regular visitor of that unit some years ago. And today, with the change of one person, there is a change in the entire institution. So this is not an ordinary profession. It is something extraordinary. Some passion is needed for that purpose. A fear of God, the fear to, or a will and a passion to work, to serve the humanity, the ailing and the painful person. I think it was long ago when I read something about a person, a man of vision and wisdom, and he was Charaka Samithya. Charaka Samithya was a Chinese. and about 120 to 162 AD, he was a physician. And he mentioned that there are three kinds of physicians in the medical profession, and I quote him. He says, three kinds of medical practitioners are found in this world, and we are talking about 160 or 162 years, 2 AD. There are three kinds of medical practitioners found in this world. Firstly, the impostors in the physician's robes, as we have the quacks today. Secondly, the vainglorious pretenders. And thirdly, those endowed with the true virtue of a healer. Sir, you are the privileged. You are endowed with the true virtues of a healer, and I praise all of you. Our health system needs drastic improvement, and that could only be possibly done if adequate facilities and adequate funds are provided to, at least I'm speaking in terms of the public sector, by the government. This is the duty of the government to do so. But unfortunately, being at the helm of a particular section or organ of the state, I've come across that very small amount, very meager amount, very little V amount is given to the health sector. And that too, this is something not laudable, is not used or given in the true sense and utilized in the true sense. Recently, we had come across the private colleges, for example, private medical colleges. Do you know the standard of the private medical colleges was in such a miserable and deteriorated condition that when I spoke to some of the experts belonging to your profession, what did they say? One doctor sitting over here said to me, sir, that the new doctors coming to the profession, they do not have the ability and capability even to monitor or to take the blood pressure. Brigadier General Zahid, Surgeon General of Pakistan, in a meeting of the ad hoc committee of the PMDC, unequivocally, very clearly stated, sir, I am scared of that day when I would need a treatment by a doctor which is being trained in the manner as is being done. Sir, our standards have really gone down. Doctors are the most important tool in the healthcare system, and we are not creating that tool as is needed. And this becomes your responsibility of each one of you, the seniors over here, that they have to supervise, being vigilant as to whether we are creating the best tool for the purposes of the healing, rather than, as has been quoted, that by Chakatra Samitya, that they should be just like a pretenders in the first category, or vainglorious pretenders, or they are the imposters. No, sir, we need to have the true virtue healers, those who can, and that is where the private medical system, which has now taken quite a big chunk of training or imparting education to these private doctors, they are being trained in. So this is again a very important. As far as other aspects of our medical care system is concerned, sir, Dr. Kiani must be aware, and maybe quite a lot of you, that Drug Regulatory Authority has been activized, they've been made active. We today almost have settled all the cases, almost all the cases with the meager amount so far left, which are in appeals, that all those devices, the medicines which are required, those have been registered. The prices have been settled. As regards the prices for certain treatments, such as the treatment of heart, the intervention, with the courtesy help of Dr. Azhar Kiani Sahab and your interventionist group, we have stated and we have settled the price of the stenting so that exorbitant amounts should not be charged from the patients. I'm sure that still we need improvement. I am conscious that the amount what we originally agreed upon and settled does not meet the present day, and we need to increase that amount because the parity and the foreign exchange disparity or the rate of change in the dollar along with the rupee, that has now compelled us to draw a new formula for this purposes. Coming back to today's workshop, I must admire the organizers of this seminar or the workshop. This is a great effort. I've always been grateful to my foreign Pakistani diaspora, those who have gone abroad, and the gentlemen like you are an asset to Pakistan. We always require you, we always need you, not only to come and treat certain people, particularly for which we do not have the expertise, but also to educate the doctors who cannot afford to go abroad. And let me share with you one important thing. Dr. Huma, she perhaps is in a children's hospital. Few weeks ago she came over to my house without any appointment, and somebody came and told me that there is Dr. Huma Chima along with her husband, those who want to meet me. She came in and asked what is the issue. She said, sir, there are 13 children in my ward. They are in critical condition. They require transplant, liver transplant. And that is for the first time I came to know that in Pakistan we do not have any system for the purposes of transplant of these small babies. What a misfortune of the country, was unfortunate. We have to go to India, for which visa is not a very asan thing to apply or to get. We have to go to China, where again the language problem, and it's quite expensive. So I asked her, what is the difficulty? Why can't we have these transplants in Pakistan? She said the only reason is, sir, what she, and I believe, let her not be blamed about it, that we do not have in the care health system the experts of your category and nature. You people are being regulated and governed by regulatory authorities who are the officers of DMG or some other department, grade 19 or 20 officer who has no clue about the difficulties which are being faced or could be resolved by you people. I remember of those days, and somebody senior sitting over here must be also aware about Professor Mian Iftikhar Sahab. Professor Mian Iftikhar, a very well-dressed gentleman, I believe he would wear a very white suit all the time, and he was the health secretary and he was the professor also. Why can't the provincial health secretaries be the doctors? Rather, they should be. And I'm interacting with the government that this kind of arrangement should be made, that they must, who knows about the real issues, the real problems, must be given the responsibility to resolve their issues and their problems. So coming back to Huma Chima's issue, I said, now what is the problem? She said, Ji, there is no system over here. I spoke to Dr. Jawad, who was presently working as an administrator of the PKLI, which we have taken over. He said, no problem, we can have this operation done, transplant done with a couple of days' time or a week's time. So I said, okay, then we'll start on last week of December or first week of January. Everything was settled. Donor was present, which is the mother, obviously. The patient was here. The hospital, according to our understanding, on which we had almost spent about 22 billion of rupees. That is meant for the purposes of the transplant in Pakistan. I thought, and it was supposed that it is in proper shape, and that was the place where we were going to hold the first operation. Now the question was about the doctors. That is where you come, sir. We were finding difficulty because no expert trained doctor for such procedure. I came to know that Dr. Khalid Sharif in Birmingham, he is one of the experts who can do it. I personally spoke to him. Very kind of him. He said, sir, though it will be around the winter vacations, people working over here almost, they go for their vacations, the winter vacation, the Christmas vacations, and we give the cover. But still, we will manage and I'll come and have that operation done. All settled. Then one day a meeting is conducted and I'm told that the basic things in the hospital PKLI, on which we have spent almost 22 billion of rupees, are not available, not only for the purposes of holding the procedure of a minor, but even of an adult. This is the pathetic situation, that we spend money and we do not get a proper or appropriate paraphernalia and superstructure to do the needful. Very shamefully, sir. I am speaking for myself. I had made a promise to some child who was to be operated that day. I don't know the name. It's shameful for me that I could not fulfill the purpose. I could not fulfill my promise. Sir, we have to show our passion now. We have to do extraordinary things. We have to take unusual steps to improve this healthcare system. I've been roaming around, as I've told you. Even today, I was supposed to be holding a court in Lahore for this very purpose, to revamp the United Christian Hospital, which has been at a point of time a grace of Lahore. And today, when I went and saw, it's a khandar, almost a khandar, Dr. Sahib. I was to hold a court today for that purpose, but as Dr. Kiani Sahib has asked me, and it was my passion and requirement even to be present with you people, I'm holding that court, going back to Lahore at 5 o'clock in the evening, sir. I have asked the doctors of Lahore city, I have asked and requested the doctors of our major cities in all of the province, sir, can I do anything more? Believe you me, sir, believe you me, I am not exaggerating, I am not trying to aggrandize my position. Almost each and every important expert in your profession has said, you have done enough. The foundational things have been done. It is only now the execution of those policies which we have made and laid down that those have to be implemented. Sir, PMDC law is complete. I have sent the draft instrument to the government of Pakistan for the purposes of enforcing that law. And you will be very happy to see one day, irrespective, regardless what the changes are brought by the government, that it shall be the law which shall serve the healthcare system right from the very genesis, right from the very important and foundational. Sir, we have settled that all the medicines in Pakistan which are to be supplied in the hospital free of cost, they must be evaluated, analyzed and passed or rejected, whatever it is, within a period of 3 weeks, so that those should be available. We have settled the guidelines for the purposes of the equipments which are necessary for the hospitals. Kindly go and have a look at Sheikh Zayed Hospital. Sir, I request you to kindly go and look at the PIMS Hospital. Kindly have a look at the PIC. Kindly have a look at the Jinnah Hospital in Karachi, and so many like that. Things have improved because the foundational aspects have been taken care of, and it is now the duty of the executive part of the state to keep the things going on and to implement and enforce what in letter and spirit is needed for the healthcare system revamping. I'm very happy to be amongst you. I have always been open that any suggestions, good suggestions from you, because you are the people, real people, those who know what the issues and the problems are. And here is the shoulder which is being lent by the Supreme Court of Pakistan, that for the purposes of health, which is directly connected to, inseparable, hermetically connected to the right to life, the Supreme Court of Pakistan, inshallah, shall be doing anything which is expedient, essential, imperative and necessary for the healthcare in Pakistan. That's what I want to say. Thank you very much.
थैंक यू सर। इसके साथ ही अब मैं वोट ऑफ थैंक्स के लिए दरख्वास्त गुजार हूँ डॉक्टर बशीर हनीफ साहब से। डॉक्टर बशीर हनीफ।